I have a pop quiz for everybody. What do all of these people have in common with me? Any guesses besides you two?
You're famous?
I'm not famous.
Thank you.
Close. Y'all have ADHD, which I'm going to talk to you about. So what ADHD is attention deficit hyperactivity disorder, which is a neurobehavioral disorder normally discovered in childhood. It can last through adulthood. Some people outgrow it, but some do not. They usually have difficulty paying attention, controlling impulsive behaviors, and sometimes they're overly active. They're often mislabeled as unmotivated persons or scatterbrained, hyper, or lazy, but that's usually a result of an undiagnosed child with ADHD. There's 4 subtypes. This is inattentive, hyperactive / impulsive, a combination of the two, and not otherwise specified, which you might hear me say NOS, which means not otherwise specified. To be diagnosed with the inattentive type, a child has to have 6 of the following symptoms that persist for 6 months, that are maladaptive and inconsistent with developmental levels. So these include they fail to give close attention to details or make careless mistakes, they have difficulty sustaining attention, they don't appear to be listening, they struggle to follow through on instructions, they often have difficulty with organization, and they avoid or dislike tasks requiring sustained mental effort. They often lose things for necessary tasks, and they're easily distracted, and often they're forgetful in daily activities. Now, the criteria is the same for the hyperactive impulsive type, except for exactly what they have to have. So they have to have 6 of the following, again, for 6 months. It's maladaptive and inconsistent. So this includes persons who fidget with their hands or feet, or they squirm when they're in their seats. They often have difficulty remaining seated. They run or climb excessively, which in adulthood can be feelings of restlessness. They have difficulty engaging activities quietly. They talk excessively. They blurt out answers before questions have been completed. They have a lot of difficulty in turn-taking situations, and they often interrupt or intrude on others. A combination of the two is 6 of each of those. So, and that has to happen for 6 months, so on and so forth. Not otherwise specified is a little bit different. It's when there's an insufficient number of the criteria met, but enough that it disrupts their everyday life. So for example, if a child had 4 or 5, say, of the inattentive type or the hyperactive type, they could be diagnosed with ADHD, NOS, not otherwise specified. When diagnosing, clinicians need to be very careful to not misdiagnose, because that's been a problem that's recently come to light. These children can be diagnosed with ADHD when in reality they have oppositional defiant disorder, conduct disorder, anxiety or depression, learning disabilities, Tourette syndrome, or bipolar disorder. What they use to diagnose is the DSM-4 TR, which stands for Diagnostic Statistic Manual or mental disorders, and it's the 4th edition, the text revised edition. Currently in this manual, it's only a childhood disorder. But because of research recently in the DSM-5, which comes out in 2013, people are really excited about that, they're considering options for adults as well because of the research. Now, what causes this? A lot of it can be genetics, brain injury, environmental exposure such as lead. There's also a correlation between alcohol and tobacco use while a woman is pregnant, which can result in low birth weight or premature delivery, which also has relevance. And when I say biological, I mean that the neurotransmitter dopamine has been found at lower levels in individuals with ADHD, as well as they have lower brain activity in areas controlling attention, social judgment, and movement. But there's a lot of myths about what causes ADHD, such as eating too much sugar, watching too much TV, poor parenting, poverty, and family chaos. But there's no scientific evidence to support any of these claims. However, some of these occurrences in a child's life may make symptoms worse. So who is affected? 3 to 7% of school-aged children, which equals about 4.5 million children ages 3 to 17, are affected. Boys are 2 times more likely than girls to have ADHD. And as it says here, 75% of boys are hyperactive as opposed to 60% of girls being hyperactive. So that's definitely a difference of how each gender is affected. 60% of adults that were diagnosed as children with ADHD maintain the diagnosis as adults, which equals about 4% of the total population, which is about 8 million adults. However, few adults with ADHD are diagnosed. I have some pretty interesting statistics for you. Of every 100 children diagnosed with ADHD, 35 won't finish high school. 25 will repeat at least 1 grade. 52 are abusing drugs or alcohol. 40 have tried alcohol or tobacco at an early age. 19 are smoking cigarettes versus 10% of the general population. 75 have interpersonal problems. 20 have set fires. 30 have engaged in theft. And 25 will be expelled from high school for misconduct. Some more statistics is that many studies have actually shown that approximately 50% of all inmates meet the criteria for ADHD. Teens are 5 times more likely to spend time in a juvenile facility if they have ADHD, which, being an intern at a juvenile facility, for girls, I can attest to that because every girl that I have met has had a diagnosis of ADHD there. Studies have also found that 40% of all cocaine and opiate abusers meet the diagnostic criteria for ADHD. So what's a parent supposed to do? There's many different treatments for ADHD. Medications are the most common treatment. There's stimulants and non-stimulants, and there's only one non-stimulant that's been approved by the FDA, which I'll talk about in a little bit. But stimulants are the most common, and for adults it shows 2/3 improve when they take stimulants, but there's some difficulties with that because adults that have been diagnosed with ADHD tend to have a substance abuse history, and in that case, this is a controlled substance, and they're afraid that it might be abused. Also, there's also short-term medications, and those you have to take multiple doses per day, and since these individuals tend to be forgetful, it makes them non-compliant with their medication, so it makes it not effective. Often in the evening, like after it's worn off, these adults will have trouble doing housework, paying bills, helping their kids with homework, even driving, and sometimes they'll abuse substances like alcohol to relax. Parents are concerned about their children's bodies becoming addicted as well. The non-stimulant that I was talking about earlier was Strattera. It's the only one that's been approved by the FDA. There's no abuse potential for this, but some feel that it's less effective. Overall, medications have proven to be effective in the short term for 3/4 of individuals. There's also behavioral treatments, which includes individual cognitive and behavioral therapy, relaxation training and stress management, behavioral coaching, and job coaching or mentoring, as well as family education and therapy. Other options, though they're not scientifically proven, can include biofeedback, special diets, allergy treatment, megavitamins, chiropractic adjustment, special colored glasses, which I didn't know that. And personally, I know somebody who went through martial arts to treat his ADHD, and that helped him develop a sense of discipline and respect, as well as self-esteem. I can explain to you guys what it feels like to have ADHD, and a good example would be climbing up a mountain with a backpack full of rocks. You feel like everybody's going way ahead of you and way faster, but when this person is given meds or treatment, it feels like they're taking a few more rocks out and a few more rocks out, and then they're able to go up that mountain a lot faster. But in conclusion, don't diagnose a child yourself. If you have suspicions that one of your students or a coworker or something may have ADHD, talk to the parents about it, because there's a stigma associated with having any sort of disorder. So if a child's hyper, let kids be kids. Not all of them have ADHD, which has become a problem in recent years. So please let this up to the professionals, but do inform parents when you suspect a child of having ADHD because of the future consequences it can have. I hope it was helpful, and thank you.